Hi, and welcome back to Critical Moments with a Neonatal Nurse Educator, part 38. My name is Lisa, and let's talk about a critical moment, one of those unforgettable deliveries that we experience, and that's a baby born with spina bifida. In that first critical moment, your priorities as the NICU nurse are protection, thermoregulation, and teamwork. You've already prepared your supplies, right? You've created kind of some sort of donut so that it can go around the defect, something like this, because as soon as the baby's delivered, you're gonna avoid placing anything directly on or near the defect. You're gonna receive the baby onto a sterile padded surface. You're gonna cover that open area with a little donut that's saline, moistened, and has non-adherent dressing that's gonna go over it. You're gonna keep the baby prone or sideline to prevent pressure and contamination, depending on what they need for their airway and their breathing, because that's the other focus that's going on. Part of this teamwork is that you're helping deal with the defect while someone's dealing with that, just like any other newborn. We're gonna keep that defect protected, and then we're gonna remember that these infants lose heat quickly, so make sure you've pre-warmed your environment, you're on a radiant warmer, and then we're gonna start working on communicating our findings as we transition back to the NICU. So what's the level of the lesion? Is there a presence of leakage? What's the tone and movement of the legs? We've already initiated our latex-free precautions, and now that we're in the NICU, we're gonna get an IV going, we're gonna get fluids going, because this baby's gonna be NPO until surgical planning is complete and they've recovered from their surgery. But in those first minutes at delivery and in the NICU, your attention to detail set the tone for the course of care. You're this bridge, right, between the delivery team, the neurosurge team, the family, who's trying to process everything that's going on and seeing this little donut on their baby's back. This is a defining NICU moment when your skill, preparation, and empathy come together to protect a very fragile start to life.